Hey everyone. Hello, the Hormones Balance and Wellana community. I'm just gonna give us like a few more seconds. We're gonna go live on Instagram as well, since we are broadcasting to a number of different platforms. All right, super interesting topic today and completely new to me. I've only found out about it 2 weeks ago while talking to Dr. Jennifer Simmons. We were discussing holistic and integrative breast health, and she is a big fan of a new testing technology that well, I say just came up, and I'm sure you guys have been around for a while, so we'll learn about that in just a second. But a super cool, very low, non-invasive way of testing for cancer markers way early in the game. And as you know, Welena and at Hormones Balance, we have a strong belief that it's all about prevention. It's all about dialing prevention, which would include things like dialing in your diet, dialing in your lifestyle choices, monitoring your estrogen metabolism, making sure that your sleep is prioritized, that all the good stuff, your inflammation markers are down, all the good stuff that that platform. I talk about this all the time. And we also want to couple that with some early detection, right? Dr. Simmons talked about it last week, or was it 2 weeks ago, actually, about not being a fan of mammograms, and I'm not a fan either. She had other reasons. Mine is mainly the fact that it's a very late detection mechanism. We are a lot for me, before I knew of Auria, which was what we're going to be talking about, I used to use thermography, which I think is a better option in way earlier detection. And then Auria came about, and this is who I have here today with me, Ellie Doyle, who is a nurse practitioner. Hi, Ellie, who's a nurse practitioner with OraCare. And you guys do some phenomenal early detection of breast cancer markers that's pretty outstanding. Could you tell us a little bit more about this so that we can give a little bit of peace for the healthy skeptics, which I think we all should be to some extent?
Yes. Yes, an advocate for your own body is an important piece for sure. So Auria has been around welcome to the public, for a couple of years now. We utilize tear samples to collect data on inflammation occurring in the breast tissue. So we're looking at 2 protein biomarkers that are present in your tear sample whenever inflammation is occurring. And those biomarkers are at higher levels with different kinds of, with different amounts of inflammation. So we can take your tear sample and look and see, is there inflammation occurring in your breast tissue, which makes it far less invasive, very easy, takes a couple minutes at home to do, much more comfortable than most other screening modalities available to women currently.
Yeah. So can you tell us a little bit about like what's in the tears? And I mean, whoever came up with that idea, which is just that in itself is mind blowing to me. We have a little bit of a sound issue. I don't know whether it's my side. Let me just mute myself and then see whether this goes over. It might be on your side, Ellie. Would you mind maybe mute yourself and then unmute yourself? Oh, I still hear it. Okay, can you guys hear a crackling sound? Or is it just me who's okay? It's gone away now. All right. Okay. All right. So what's in the tears? And like whoever came up with that idea of testing tears, like tears.
Yeah. We were founded in Fayetteville, Arkansas, here in the Midwest southern region of the United States, where a doctorate student actually found that you can locate these 2 proteins that have been indicated in inflammation in the breast tissue. Those proteins are S108A and S109A. And those 2 proteins have been shown throughout a lot of different research as protein markers for inflammation, especially in the breast tissue.
That's fascinating. So let's talk about what is the error or accuracy, I should say accuracy percentage of that early detection, and how early are we talking? So I think those are 2 separate questions. So let's talk about like how early is early.
Yeah. So our data is actually best for the earliest forms of cancer. So stage 0, stage 1, we really have honed in on and been able to get really 96% detection rates of those types of cancers, which is the most beneficial because, as we discussed earlier, other screening modalities struggle to find those very early cancers. And so Auria can be an addition to any kind of screening to capture those stage 0, stage 1s as early as possible so that we can minimize treatment that has to be done in the future.
Yeah. And can we talk about what kind of cancers are you guys able to detect? There's a number of different types of cancers. Which ones are you able to detect?
Yeah. So we've been able to detect all breast cancers in our samples with the exception of inflammatory breast cancer. Inflammatory breast cancer presents its own challenge. A lot of that is based in the skin tissue as well, which is a little bit different than some of the breast tissue. But your the carcinomas, IDCs, we also detect abnormalities like hyperplasias, which some people refer to as precancers. And those are the morphing of the cells that eventually will either lead to a cancer or lead to just a change in the breast tissue. It's the earliest form of precancer you can detect that tells you whether or not there's something changing in the breast tissue that could be concerning. So we've had great detection rates of those as well. We can also detect some benign changes in the breast tissue that cause inflammation, like bothersome cysts. Some women have cystic breast tissue, which could create some inflammation, which can be noted on Auria as well. And then some of the benign growth, there's one benign growth that occasionally, with a large growth of it, can create some inflammation. So it gives a lot of info about your breast tissue.
So just to confirm, so everything from BRCA1, BRCA2, HER2, which are genetic ones, and then estrogen receptor positive breast cancer, progesterone receptor positive breast cancer, all of that is covered. What about triple negative breast cancers as well?
Yep, because these proteins are actually detecting the inflammation that's created when the cells are morphing into a cancer. And so we're actually detecting the cellular changes. It doesn't matter what's causing those cellular changes. We can detect the inflammation that's present from them, whether it's hormonally based, non-hormonal.
Right. So if there is some inflammatory markers that are elevated and it gets picked up by the tears, so there's a chance that it's an inflammation, but not necessarily breast cancer, correct?
Correct.
And then what does a person do? Let's say if the test comes back positive, what's the next step?
Yeah, so if your test results come back clinically significant, we do offer educational sessions as well with me. It's a 45-minute educational session where we can go over all of the risk factors, all of the breast education tools, like how to do a self-breast exam, what are you looking for on your self-breast exam, all of the educational pieces you have access to regardless of what your score on Auria is. You can schedule that at any time to go over those results. But also, if you come back with a clinically significant score, it's really important to have that conversation with medical providers, homeopathic, naturalistic, functional medicine, whatever path you decide to take, having that conversation with them and seeing what kind of additional screening, whether that be a clinical breast exam that's in depth or a thermogram or whatever screening modality is most comfortable of choice for you and your provider. And to go ahead and with that to verify, is this something that could be a cancer that we need to, act on quickly? Or is this some other change in my breast tissue that could be occurring for a change in hormones? Is it occurring because there's some other kind of damage occurring to my breast tissue that's non-cancerous?
Right. So what I'm hearing you say is that Auria is able to say that something is inflammatorily active in the breast, but is it able to detect, to tell us, like, based on a type of protein or exactly which type of breast cancer it is, or whether it's cancer or just inflammation, or not really? That's not its function.
Yeah, so the only current way to diagnose the type of a cancer or the type of abnormality is through imaging. And then to get the actual makeup of a cancer is to do a biopsy,
Right.
which is invasive, definitely. And that's something we're working on, is adding new proteins and new biomarkers that are being developed in research so that we can give more information from just a simple tear test.
Yeah. Okay. And, and I mean, in my view, it is such a huge win already, because the earlier you can detect the abnormality, the more preventable it is. Early stage breast cancers are highly, I don't want to say easier to manage, but the survival rate is very, very high, right? Compared to waiting for to stay for stage 3, stage 4. And so that is, I mean, that in itself, I think is a huge win. The other thing I loved about the fact that you guys are so inexpensive, you guys, it's $159, for which you also get 20% off, which is like $31 or something like that. And I'm just gonna put it out here. The website address is auria.care. You use the Welena20 coupon code to get, it's not 20, sorry, I mistyped it. It's actually, let me just take this off and correct this. It's 20% off. So I think it was like $31.40, something like that. So that gives you 20% off. And, that in itself, I mean, for just over $100, you are getting something that can really protect you. So I got my kit here. And so it's best practice is to send it on the same day. So I'm going to wait till tomorrow because today I've got a busy day. But it's really as simple as I haven't opened it yet, but it's basically, there's a little. Well, let me open that and just kind of. I like to do show and tell instead of just tell. Just want to show you just really how simple it is. So, do you want to guide me through this? Like, what do I do with this little guy here? I'm not going to open this up because I don't want to contaminate it. But just maybe to guide us through, what do we do with this?
Yeah, so that's a former test. It's a form of medical testing that's been around for a long period of time. And so on that, you'll see little markings. The goal is at the very end, there's a little rounded piece. You'll just fold that little piece over, and there's step-by-step videos and instructions and everything in the package as well.
Yeah.
You'll fold that little piece over, and you'll tuck it right here in the tear duct area of your eye. People get nervous sometimes because the eye can be intimidating, but it's even easier than putting in a contact. So if you've ever put in a contact, it's much more comfortable than that. You honestly don't even know it's there. So you place it right at the tear duct area and just let it sit. Set a timer on your phone.
Can you wear makeup? Can you wear makeup while doing it?
Yep, you can wear makeup. You can use, it doesn't matter if you've used eye drops. It doesn't matter what your day has looked like prior to taking your kit. The only thing that we want to avoid is anybody that's using antibiotic eye drops for a current eye infection. That can cause some changes in our buffer solution. So we would prefer that if you're using antibiotic eye drops to wait until after you're finished with that cycle. But otherwise, whatever you've been doing that day doesn't matter. You can slide that little tear sample in there. You can keep working on your computer, do whatever you need to do, set a timer for 5 minutes, and then pull that little strip right out, put it in our little buffer solution, slip it in the mail.
The buffer solution is right in here. Yeah. And then you put that back in the box. It comes with a label at the back there, and you send it off. And how soon do we get the results?
Yeah, you get your results within 10 business days. Honestly, it's a lot quicker than that. Most of the time, it's very surprising. People get the results in a few days and they're shocked. So it's a very quick turnaround time, very easy to get some additional info on your breast.
I cannot tell you how exciting this is for me. I mean, first of all, it's Breast Cancer Month this month. As we all know, it's Awareness Month. I really dislike that term, awareness, because we're very well aware it's a problem. Yet the only solution seems to be just pushing women out for doing mammograms and not much more than that. This is the kind of stuff, your stuff doesn't prevent cancer, but it helps early detection. It's already one step closer to like true management of breast health. The stuff that I do is all about prevention. And, for me emotionally, like I was so moved when Dr. Jen mentioned that on a call 2 weeks ago. I literally have this reaction, like I've got to have this tomorrow and test it because, I have family history of breast cancer, both sides of my family. I'm a horrible, it's not breast cancer, I take it about estrogenic cancer. So all my aunts had passed away from breast cancers and then uterine cancers and ovarian cancers. And so we have like a sick joke in my family, of course, perpetuated by the man, that no woman has a uterus after 50 in my family. So my sister and I still have a uteruses, but we also put a lot of work into preventative health, right? And so that's why I'm so, I'm conscientiously monitoring my estrogen metabolism. I do Dutch testing on a regular basis. I look at my metabolites of estrogen. but there's that, but it's also like that other. I don't have BRCA. If for those of you who have history of breast cancers, you've got to test for your BRCA1, BRCA2, your genetic predispositions on that, but this is the kind of stuff that I really love, Ellie, and I'm
I've
so
lost the
glad.
sound on my end. I'm not sure if you can still hear me or not.
You can't hear me? Okay, let's see if you guys can you hear us? Let's see in the comments. I can't hear you now. I've lost you.
Okay.
Okay, now it's good.
Returned. Okay.
And I can hear you so much better now too. So whatever you did is the right thing. Okay, so so let's dive into a couple of questions that are coming in. Susan here is asking, can this test be used for monitoring active breast cancer? Great question.
Yeah, that's a great question. We are working right now on gathering samples for data on remission in active breast cancers. As of right now, Auria is not intended for the use of active breast cancer or for monitoring remission. There are some individuals that are currently testing for us so that we can get more data on that. And our goal is to be able to also utilize Auria to track for remission and oh goodness, the word has left me, but to prevent return of breast cancer so that we can monitor for that and make sure that we're detecting things if they return as quickly as possible.
Yeah, that's super important. So then we have a question about, which was going to be one of the things on our list to talk about, dense breasts. So Stucky is asking, so we have a ton of questions on Instagram coming in that we can't see on a monitor here. Ali, just so that you know, how does this help with someone that already shows very dense dense cystic breasts?
Okay, great. So with dense breast tissue, it's really difficult to see all of the breast tissue on general imaging, especially the mammogram that most women are using yearly with their health insurance. I always use a stained glass metaphor. So when I look at mammograms of women with dense breast tissue, it's kind of like looking through a stained glass window. I can't make out a lot. I can kind of make out some shapes and things, but it's nowhere near as easy as looking through a clear pane window. So obviously things are getting missed that really shouldn't be, especially the early cancers that are small and harder to detect. So the great thing about dense breast tissue in Auria is we're not looking through any densities. We're using your tear samples that are giving us direct info about inflammation. So we're a really great tool for dense breast tissue, so that you don't have to stress about something being missed, because I can't visually see it with my eyes as a provider, but Auria can.
Yeah. And what's your take on, like, where do you think Auria plays a role that maybe thermography is missing out on?
Yeah, that's a really good question. Well, I think with any imaging, the hard part is access. Getting women the access to go somewhere. Transportation can be an issue for some people. Is there thermography available in their area? How do they find it if it's not something that their current healthcare provider believes in or recommends or assists with? And so I think Auria is just very accessible. It comes directly to your doorstep. You can do it at home. You can send it in. You don't have to worry about finding somewhere to go. And if you do have a clinically significant result with Auria, we have a team of support that can also help you find somewhere locally to go to get additional imaging of your choice. So
yeah,
help resource for women that just don't have any other resources.
Yeah. One of the things that we talked about before we started, you mentioned is interesting, like how in the US the recommended time for that age the woman should get a breast test done is, what did you say it was, 45?
Age 40 currently.
Okay,
Unless
40,
you have young family history. So for example, my aunt was diagnosed with breast cancer on her first mammogram at age 40.
Wow.
And insurance wouldn't have covered for her to get it done any sooner, and she couldn't afford to get screenings like that because mammograms and things are very expensive without insurance. And so the thing I love most about Auria, and that I'm the most passionate about it, is that women age 30 and up are currently approved to take Auria, meaning we don't have to wait until we're 40. and be in fear of the first time we get any kind of imaging that there's something that's been there for a long period of time and we haven't been able to manage or to get treated or get and taken care of at an early stage.
Yeah. Yeah. And that's the whole purpose of doing this. So we have had questions earlier today from emails asking about what do you do about international shipping?
Yeah, that is in the works. We definitely want to be able to get the Auria in the hands of many women as possible. Currently, we're not available outside of the United States. However, the buffer is good. That solution inside that tube that keeps your tear sample good for the lab is good for 3 to 7 days. So if you can get access to an Auria kit, we can get you some results.
Yeah. So logistically speaking, for those of you in Europe or Australia or whatever you are, if you have somebody in the US as a friend, ask them to just buy it for you, ship it over to your country. The only trick is then you have, like Ellie is saying, 3 to 7 days, which means that you do not send it through regular post. You have to probably FedEx it out to make sure that it gets no longer than 7 days, because the little preservative in there can only preserve it for so long. So that's a little caveat there, but it's doable. And who knows, maybe next year is going to be a different story. You're going to be shipping to more places.
Hopefully very soon.
Yeah. Awesome. So, and then the other question that was that we had coming in is like, all right, so you talked about the age is 40, right? What do you guys recommend for women to test starting at what age?
Yeah, so starting at age 30 with Auria is a great time. We can get a baseline of what your breast tissue is looking like, and get a baseline of what your Auria result would be. And then as you age, we have so many data points to refer back to as things change in your breast tissue. So we really know when something is abnormal occurring. So age 30, you can test as often as every 6 months, which is also helpful. A lot of screening options are only recommended once a year. You can repeat Auria as often as every 6 months, giving even more data for your breast tissue health than even just other imagings can provide.
Yeah. What is the let's see. Let me just see what other questions are coming in through. So Asha is asking, how accurate is this testing for cancer? So we kind of covered that at the beginning of the call. Did you say 96%?
Yes, 96% sensitivity, for meaning that if you receive a clinically significant result, we know that there could be a false positive rate in the clinically significant, but we chose to be 96% sensitive to breast cancers so that anybody who gets a negative result can rest assured that there wasn't something missed in their sample. So we chose to have a higher sensitivity than we did specificity. So there are a few other things that can cause those proteins to be elevated. And so if you have a clinically significant result with Auria and you've done some checks on your breast and you're continuing to do checks and you feel like confident that it's not your breast tissue that has the inflammation, we do have a little database of some additional things that we would recommend you look into if you got a clinically significant results and your breast tissue was clear. As like a small chance it could be one of these other things.
Awesome. Let's see what else. Can you also talk a little bit about the studies behind it, the science behind it? Because, our audience is very sophisticated. Those are women who've this is not the first rodeo. They've been on this health path for a long time. There is a healthy level of skepticism that we all should be exercising, myself included. Even when Dr. Jen said that you guys are amazing and she uses you all the time, I still went and asked, well, show me the research behind it, right? And so I think our audience should be asking that question too, like, what's the science behind it? Obviously, I would never put anything forward, into our community that is, questionable or anecdotal only, especially when it comes to like messing around with something as serious as breast cancer. Can you tell us a little bit about the background, the science behind it? Like, what are the studies you guys have done so far, and what do we know?
Yeah, so we have 4 published studies, and our studies, like I said, determined our specificity and our sensitivity. So knowing that we are Our actual papers are available for you on our website. You can review them at any time to understand how we got our numbers, what number of breast cancers were detected, where those samples were derived from, everything. We like to be very transparent so you can easily access the data behind where Auria came from. But we're 96% sensitive to the breast tissue and abnormalities. We're 54% specific for breast tissue alone. And again, we did that so that we would have less false negatives than false positives. We want to capture as many abnormalities as possible. We don't want any women to get false hope that there's not anything occurring in their breast tissue when they should have been making action. We were started in a couple of local breast centers and we've grown. And right now we're currently working on the reoccurrence data and getting data working with oncology, so we can have more hard data on women with active breast tissue, history of breast or active breast cancer, history of breast cancer, history of radiation, chemo, all of these things that can also alter your breast tissue. And we want to know as much as we can about how that might impact your ARIA score.
Yeah. I'm so fascinated, like, where you guys gonna be a year, 2, 3 years from now, and the level of detection you're gonna be able to do. What I also love is the fact that, you know, like when you get a clear bill of health from you guys, you can be pretty much sure that everything is clear. Now, when you get an alert that something is going on, it not necessarily means it's cancer, but it's such an early I would say a kick in the butt to really see, like, go a little bit deeper and understand, okay, is it cancer? No, it's not cancer. Okay, but why am I inflamed in my breast, right?
Right.
And that's something that I've struggled with ever since I was in my 20s, is the constant cysts. And you know, and any woman who finds a cyst or a lump on her breast that is like pea-sized, especially on one breast, you go to Dr. Google, tells you if it's on one breast, it's higher risk of cancer. Then you think like, oh my God, my you know, all of that, right? And then you go through the stress of like, which diagnostic tool do you use? It's horrendous. Like, and that's one of the reasons why I started doing this work, because I never wanted to go through that ordeal ever again. So anyway, we have more questions coming in. Sarah is asking, if you have an autoimmune condition, is there a higher chance of false positive?
Good question, Sarah. So there are 2 autoimmune disorders right now that we have data from research that indicate that one of the proteins that we are looking at in your tear sample could also be falsely positive. And those are rheumatoid arthritis and ulcerative colitis are the 2 that are current. And those proteins are elevated in your tear sample at the time of like a rheumatoid flare or an ulcerative colitis flare. So that is something to be mindful of if you have one of those current autoimmune conditions and it may be in an uncontrolled state. Your ARIA kit may be a little bit more difficult to determine whether or not that's breast inflammation. However, our lab can break down each of those proteins and indicate which one of those caused your higher score. So if one protein is elevated more than the other, but we know that that protein is also linked to your rheumatoid, there's a good possibility that your rheumatoid could have been the cause of your clinically significant ARIA result. But it never hurts to create a call to action for women to go ahead and do some additional digging into why their breast could be inflamed. Yeah.
Okay. And somebody from Auria is actually here and says, thanks you so much for all your great questions. We reply to all your comments after the live if they don't get to it. Okay, great. So let's take a look at Instagram. There's more questions coming in. One of them says, oh, I saw something and then it disappeared. Just one second. So let's talk about one. Somebody is has made a comment here. Mammogram save lives. So actually, Dr. Angelica Malik is saying, she's an MD. Angelica, I recommend for you to listen to Dr. Jennifer Simmons 2 weeks ago. I did a live with her. She's an MD, a functional oncologist, and a breast surgeon, and her thoughts on mammograms and the whole thing of like the way actually percentage-wise, what she was demonstrating, the data on how actually they don't particularly save lives because it's so late in the game. She's saying thermography is not proven. And again, thermography is very nuanced here conversation because there's some really lousy thermography and there is high sensitivity thermography. and tear test has not been peer reviewed. Can you maybe talk about that? Are the 4 studies you're talking about, have they been peer reviewed or not yet?
I believe at least 2 of them are peer reviewed.
Okay.
Verify as well with Saul.
And I actually sent out an email, and you guys can check it. If you're on our mailing list, I actually sent out an email this morning with the 4 citations with PMID numbers. And so you can actually look it up and see whether it's peer reviewed or not. All right, Giovanna is saying, how can women who this is a great one. How can women who breastfeed use this? I know with thermography, they don't recommend with breastfeeding because it's hard to see. What are your thoughts?
Yes, so active breastfeeding is in our data can cause an increase in your Auria result due to growth of the milk ducts. So there can be some small inflammatory factors present whenever you're breastfeeding. We don't have a large sample of data of women who actively breastfed while they did their Auria kit, which makes it a little bit harder. We just know from research that these proteins can be elevated with inflammation of the milk ducts when they're producing milk. So that's a great question. It typically, the inflammation from breastfeeding isn't enough to highly increase your score. It would be a small increase, but it could, depending on other factors, also give you a false positive rate.
Okay, another question we have from Celine, a great one. She's saying, if someone had just had a breast surgery to remove 2 cysts that were benign, could this give a false reading?
It would depend on how close to surgery you are. Surgical healing does cause some inflammation to the tissue as it's been disrupted. So we would want to make sure that you gave your body time to heal before taking your Auria kit so that you don't receive a false positive result from surgical healing.
Okay. Okay. Yeah, so those are, and so Vivian is asking, we kind of addressed this already, but that's okay because some people are coming on late. Is this for menopause hormonal changes as well?
So you can use Auria regardless of what stage of hormones or what current body stage your hormone is in. Any of your hormones are in. We're not actually testing your hormones. We're testing the inflammatory markers in your tears. So Auria is for anybody regardless of your stage of life or your hormonal changes that are occurring.
Yeah, and hey, you guys, about 2 weeks ago, Dr. Ellen Hopkins and I did a webinar we designed a panel for women in perimenopause, and Dutch is part of it. That's my personal favorite, is to understand understanding how we're breaking out not only our estrogen and progesterone, cortisol, testosterone, DHEA levels, but also how we're breaking down those estrogens, which is very nuanced thing. And Dr. Jennifer Simmons and I 2 weeks ago, we were talking about some preventative stuff, and she was giving like her 3 favorite foods. I was giving my 3 favorite foods, supplements, herbs, and all that, lifestyle changes. One of the things that was real music to my ears is when she was talking about like how, we like how a lot of uninformed and MDs and a lot of practitioners will say, like, when you have breast cancer or problems with estrogen, you do not touch any estrogenic foods such as flaxseed, for example, right? Because it contains estrogen. And it is such a flawed and such a incredibly myopic and poorly researched advice to women, because not only are these foods generally really healthy and actually supportive, but it's really the understanding that it's not the estrogen in itself is the problem, but how we metabolize that estrogen that is important. And that's the reason why I love Dutch so much. So this is another conversation, you guys. We are talking about the tears and early detection today, but if you want to measure your hormones, go back and look at that webinar that I did with Dr. Hopkins, and there's a whole panel there for you to order and monitor your hormones and metabolism and everything else that surrounds your hormonal health. Ellie, this was great. And let me just do a quick sweep and see whether there's anything else. Let's take one more question, which is a really good one and very valid. Evelyn is saying, what if you test positive with Auria, but your healthcare system dismisses it?
That's a common issue for everyone, I think. Doing any non-traditional testing of any kind, there's definitely can be some pushback. Our team has worked really hard to develop a provider handout to discuss the importance of Auria and the importance of other screening modalities for breast cancer. And so as a provider myself, I understand that there's a lot of bias out there, and I'm not going to say I didn't have bias before I had a family history and started doing my own research, because I'm human and I definitely did. But we've worked really hard to work through some of those barriers for people. And I think the biggest thing is finding somewhere else to get your health care. If you don't feel listened to and supported, there is a provider out there for you that will care and listen and support you. We're happy to give you the tools that we can, but my biggest recommendation is go where you feel like you're heard and understood, and that's where you need to go, because that's going to be where you get your best care.
Thank you. And that's exactly what I was going to say. This is also probably the provider who's also going to be telling that mammogram is the only safe way. This is also a provider who's going to be giving information that HRT kills women and causes breast cancers, and flaxseed is going to do this, and, all that kind of stuff that is, and we'll have no valid information about how to prevent cancer and what can you do from a holistic perspective, right? So yeah, I totally agree with you. Just find someone else, because if somebody tells you that and is not even, and here's another little tip. If somebody is at least somewhat interested, like bring the peer review, bring the research that we provided in our newsletter, or go to the OraCare website. There is a whole research tab. Download those papers, print it out, show it to your provider. And here's the thing. I've seen two types of providers. One that is like, oh, I didn't know that. That's really interesting. And they would actually want to carry and recommend that kit for their patients because they truly care. And there will be other ones who dismiss everything, saying that whatever, they, for example, saying it's not peer reviewed without even checking that it actually is peer reviewed, right? As an example. And so, and that's the kind of provider overall, in general, you want to stay away from. And then also, you guys, there's so many who do telemedicine these days, and you can always reach out to us as well, support@hormonesbalance.com. We have a number of resources that we can send you to find someone locally to you, or work through telemedicine. It's all out there. There's actually a lot more resources than you think. So awesome. Ellie, so wonderful to have you here. Thank you so much for making the time this afternoon for us. And for those of you who are going to be wanting to get the test kit, you can do so on Auria.care. Use the Wellena20 to get $30 off. And and I'm gonna be doing my test tomorrow, and then I'm gonna publish the results once I get the results, good or bad. I mean, I'm gonna own it. If it's positive, I'm gonna figure out what the heck is going on, And if it's negative, either way, I'm gonna share it with you. And if you guys are here, you follow us on social, I'm gonna definitely do some reels and stories about it. So maybe I'll do a story on like how I'm like sitting there with that thing.
Yeah, it's super comfortable. I've done a lot of them myself, and I was a skeptic. Trust me, I was like, I'm not putting something in my eyeball. That sounds worse. But
so I don't wear contacts, but so it doesn't hurt. Like
it does not. No.
Okay.
You may blink a little bit more, and you may tear up a little bit more, but we're trying to collect those tears, so that's okay. Yeah. You literally just slide it right here. It doesn't have to go into your eyeball. You can just tuck it right here on the tear drop. I mean, if you wear mascara or if you've worn any kind of eye makeup, you'll be fine.
Awesome. Thanks so much, Ellie. Thank you so much, everyone, being here today, for your lovely questions. And if you have any questions, reach out to our team at support@hormonesbalance.com. Otherwise, you know where to order the test. And good luck, and let us know how it goes. Thank you so much, Ellie. Really appreciate you.